First, you should know about risk groups. So there are certain groups that are at more risk of experiencing domestic violence, such as pregnant women. There's a 30% increased risk of domestic violence in pregnant women. Other groups include people with mental health conditions, people who are drug dependent or alcohol dependent. And of course, the single most important group that you need to think about domestic violence in are people who've experienced domestic violence before, and that cannot be forgotten. So it's important to know that domestic violence doesn't present with any 1, 2, 3 specific symptoms or signs that are particularly indicative of domestic violence. There are a broad range of signs and symptoms that can point towards a case of domestic violence. Signs and symptoms can be varied. They can include things such as a change in their mental health situation, so increased depressive symptoms, for example. Unexplained symptoms, so where a patient might have pains or ailments or aches that cannot be explained by any other cause. It might also be, one might also be suspicious of domestic violence where a patient is always coming to their appointments with an escort or with their partner. You might think about domestic violence where a patient becomes more withdrawn or quiet within their consultation. Other signs might include, for example, where a patient doesn't show up to their important hospital or clinic appointments. And they can include many, many other signs and symptoms.